My name is Dr. Cozy. It's nice to meet you. Really quickly, can I just get you to verify for me your name and date of birth? Perfect. Thank you. So, okay. You've been feeling like your ears have been a bit plugged. Okay. When did that start? Okay. Have you had any kind of runny nose, any sore throat, or anything like that? Okay. Okay. Speaking of, have you had any recent colds in the last month or so? Okay. How about, have you been swimming at all? Listening to any loud music? Do you have a history of chronic ear infections? Have you been experiencing any kind of dizziness or ringing in the ears? Okay. I know it's a lot of questions, but it is important to get a history so that way we can have sort of a clear picture of what we should examine and look for. Let's see. Do you clean your ears with Q-tips? Okay, good. Those generally just push the wax deeper into the ear. One more question here. Have you taken any medication or done anything to try and alleviate the symptoms? Okay. Do you know the strength? And how frequently were you taking it? Okay. Did you feel like it helped at all? Okay. Okay. Just taking a look here at the rest of what you filled out. Okay. So go ahead and get started. Have you had any fever or chills? Okay. First thing I want to do is just listen to your chest really quick, okay? Yeah. Thank you. Can I get you to take a deep breath in and breathe out? Good. Deep breath in again. Breathe out. Good. Deep breath in. And out. Last one. Deep breath in. And breathe out. Good. Okay. Your chest sounds clear. If it's okay with you, I'd just like to do some tapping on your chest just to completely rule out any lung involvement, like in the case of pneumonia. Thank you. Sometimes different ailments can present in unexpected ways. Okay, looks good. Just need to roll that out first. Just want to take a quick look at your eyes and your skin on your face. Is it okay if I touch you? Thank you. Gonna start with your eyes first. Just open for me. Look straight ahead. Gonna do my best not to shine the light directly into your pupil. But I just need to check this clear up. Can I get you to look up? Thank you. Okay. Look straight ahead. You can relax and down with the eyes. Just gonna take a look at the skin around your face or on your face. I will get to looking at your ears, but oftentimes there can be information presented and other symptoms. Our body is a whole series of symptoms, and our systems, not symptoms. Our body is a whole series of systems that work together. And if one has an issue, then often it can present in others as well. Yeah, sometimes when I'm concentrating, it's hard for me to put the correct words together because I'm focused on something else. That is your skin at the moment. Skin looks good. Then if I can just get you to open for me. Thank you. Just looking at the back of your throat for any redness or drainage, post-nasal drip. Relax. Just gonna feel around, okay? Can I get you to swallow for me? Okay. And again. Okay. And again. Thank you. Any pain anywhere, tenderness? Okay. Just have to check. So now let's take a look at your ears, okay? So to start, I'm just going to take a look at the exterior portions of your ears, okay? Just looking for any sort of issue with the skin. Because it is common to develop skin infections in the ear, the cartilage. Take a look at the other side as well here. I'm just going to take a look inside, okay? Is this okay? Is there any tenderness or discomfort? Not seeing any sort of signs of drainage or inflammation here, but there is a considerable amount of cerumen in the ear. It is quite impacted here. To the other side. So, is this okay on the side? No pain? Okay, just need to check. I am seeing the same thing on this side with quite a bit of earwax inside of the ear, which is blocking my view into the inner ear. So, okay. It would appear that what's going on, I believe, is that we have some impacted wax. that could be the extent of the situation, or it could be blocking my view from something else that's going on. But in the meantime, we are going to need to give your ears a clean to make sure that there isn't any issue with the inner ear or the tympanic membrane. So if it's okay with you, if it's okay with you, I would like to clean your ears a bit. It's not painful, I promise. It does use water to flush the ears out, but what we will do is have you lie back, okay? I'm going to be using some small syringes filled with water, and they're just going to spray inside the ear and flush out anything inside. It's not painful. It tickles a little bit, but it doesn't hurt, I promise. And then if there's anything remaining that's making it difficult to get a good visual of what's going on, then we'll go in with a brush and just kind of brush some of it out, so that way I'm able to see and make sure that your eardrums are okay. There's no fluid inside of the ear or any other issues causing you to have this discomfort and pressure. Okay. So to start, grab a tissue here. I'm going to administer some ear drops, which are going to help and break up some of that wax, so that way this goes a bit more smoothly. So start this here. And I'm just going to place my tissue so that way if there are any drips, I catch it. So that should start to fill up a little bit. Let's get the other side here now as well. So just using my tissue here. Okay. Toss that out of the way. So there should be fizzing in your ears, which is totally normal. It's just the process of breaking up the wax. And let's have you lie back, okay? Okay. How are we doing here? Are we doing okay? You're okay lying down like this? Okay. So to start, I'm going to be taking some paper drapes and placing them around your head so that way don't have anything dripping on your clothing. Making this uncomfortable for you. I'm going to tuck right under your ear. Grab more for the other side. Making sure we're all tucked in here. Okay. And get some tissues prepared. And these I'm just gonna set just over your ear in the front. I know there's a lot going on here, but I don't want anything undesirable dripping on your clothing. Okay. two basins here that I'm going to set underneath each of your ears. And, sorry about that. These are going to catch any water. Is that okay if there's no plastic digging into your face anywhere? Okay, good. Sounds like it just started raining. So, these are what our syringes look like. Don't be alarmed by the tip. And just make sure that it's very precise where the water is directed. It's not going to be uncomfortable, but if it is, I want you to let me know right away because it's not supposed to be, okay? So I'm going to feel it going in your ear like so, just like that. Position this carefully. That wasn't bad, right? No, it's not bad. That's it down for right now. And we'll go back and forth so that way everything feels even. Feel me placing the tip inside your ear. Okay. How are we feeling right now? Are we okay? Okay, good. Just have to check. Okay. So we're gonna go in again on the other side. Okay. So, and one more on the other side. Here. And I'm just going to just some puffs of air just to make sure that okay. I'm going to use a very gentle little brush here, okay? Just to make sure we got everything else out. Great. It looks like we're good here. Let's just check. Take a proper look when we have you sitting up, okay? But for now, I think we got everything, so let me remove these tissues. And very slowly, let's get you sitting back up, okay? Okay, so now that you're seated back upright, how are you feeling? Are you feeling any kind of dizziness or anything? Okay, good. Just need to check. Sometimes if there is fluid in the ears, but there was a lot of wax, it can cause a shift in balance, so it's important to rule that out. So now that you are seated back upright, I'm going to take a look inside of your ears, okay? So, is this okay? Is it tender at all? I do have a clear visual now. another look at the throat. Provided I can get my light attached. Because I can't see fluid on otoscope exam doesn't mean that the presence of fluid is not there. Given that if it's deep enough in the ear, I won't be able to see. So I'm going to take a look in your throat. Don't be alarmed, it's just a light. And I get you to open for me. Thank you. So, just looking inside. I'm not seeing any evidence of drainage in here. It's a nice, healthy color of pink. Okay. I'm just going to feel around your throat, okay? I want you to let me know if there are any tender spots, any pain anywhere. Just going to press on your face gently just to make sure that any potential fluid didn't escape to any of the sinus cavities. Any pain or pressure anywhere? Okay. So I think that this pressure that you were feeling was the result of just having quite a bit of wax in the ears. So what I'm going to do is I am going to reapply the drops, okay? They shouldn't fizz this time. And then I'm also going to write you a prescription for the same ear drops that you can pick up from your pharmacy and apply twice a day, alright? Those drops should help to keep the earwax from building up to that extent again. I definitely would not advise you to try and clean your ears on your own. Just because the eardrum is a very delicate, very thin membrane, it's very easy to injure it. So if it's smaller than your elbow, you don't want to put it inside your ear unless you are a professional, okay? Okay. So how are you feeling right now? Okay. No dizziness or feeling of loss of balance? Okay. Good, good. Just need to make sure, because that can indicate the presence of fluid. Because like I said, now that all of that wax has been removed, if there is fluid present inside of the ear, that can allow for it to start moving more freely, because that cerumen that was holding it in place is now gone. So need to rule that out completely. It's okay. Just making sure here. Yes, you did put a pharmacy on your paperwork. Good. I'm just gonna write a prescription here for you. So we will get that called in for you right away. And then in the meantime, if you do start feeling that pressure again, or feeling like the wax is reaccumulating in your ear, I don't want you to try and take care of it yourself. I want you to call and make an appointment, come back in, and let us take care of it for you, okay? Okay, good. Very important. So, do you have any questions for me before I step out? Okay. Well, if you happen to think of anything, feel free to give me a call, okay? It was really nice to meet you. Alright, we'll get this called in, and like I said, call me if you have any questions or you need anything.